several prenatal and perinatal, neonatal, and familial risk factors have been associated with autism spectrum disorders. The objective of this study were to assess frequencies of assisted reproductive technology and prematurity in cohort with ASD. Further, to examine possible relationships between ART and autism symptomatology. The cohort included 507 participants with mean age of 42.2 months. All participants were diagnosed within the autism spectrum using ADI, ADOS, and clinical evaluation. Our findings indicated significantly higher frequency of ART, gestational age below 36 months, and low weight birth under 2.5 kilos in the ASD cohort, in comparison to a large Israeli newborn cohort that included over 50,000 newborns. Since findings of prematurity were already reported in several studies, I will focus on the ART findings, on our ART findings. We divided the cohort into two groups, with and without the use of ART. The distribution of maternal ages in both ASD groups did not differ, suggesting that the ART group was not specifically older. In addition, in young maternal age range under 29 years of the ASD cohort, the frequency of ART was still very high, of 8.7%, and did not differ from the rate in the entire ASD cohort that was 10.3%. The ASD group with singleton birth who had ART had similar rate of prematurity and low birth weight in comparison to the large Israeli newborn cohort. However, the ASD group that did not have ART, even after removing the twins' pregnancies from the cohort, showed increased rate of low birth weight. Autism symptom severity, adaptive skills, and developmental trajectories did not differ in both ASD group, with and without the use of ART. To conclude, ART, gestational age under 36 weeks, and low birth weight are risk factors for ASD. However, ART does not represent a special endophenotype in ASD. Thank you.
Thank you.